I've always had an interest in infectious diseases. When I was in college, I was more pursuing a path in medicine. And it was actually while I was doing a service trip to Ecuador that I first discovered public health, and that completely changed my focus. In Equator Province, DRC, they reported laboratory-confirmed cases of Ebola of this past year, 2018. It only takes one confirmed case for it to be declared an outbreak. And so on May 8th, they formally declared that outbreak. And about a week later, some of my former colleagues contacted me to see if I had any availability to support. So I was there with them in June, and after 54 cases, on July 24th, the outbreak was thankfully declared over. Unfortunately, about 1 week later, another Ebola outbreak was declared on the opposite side of the country. So that outbreak has been a bit more challenging. I was recently brought on to support the normal ongoing health emergencies program work for WHO remotely this time. So I'm helping to support some of their day-to-day activities while some of the regular staff is on the ground over there now. Schistosomiasis is a parasitic disease. The way people get infected is when they go to their water supply to either collect water, to wash their clothes, to bathe, or whatever, there can occasionally be parasites swimming in the water that were released from these freshwater snails. So we are working in villages around the Saint Louis area and up near Lac de Guiers. And in those regions, prevalence of schistosomiasis in school-aged children often ranges between 70 and 90%. And so we've gone over there twice now, and we frequently are in the water looking for these snails, hoping to figure out ways to maximize the control. We are hoping to come up with a remote sensing model that will determine where these places are. And so instead of having to drive for hours and hours and hours and waste manpower and fuel to figure out where these snails are happening, we'll be able to use these satellite images and the predictive model to say, okay, here's where we need to target, so we can send those resources there. We've got a lot of complex challenges in the field of public health, and so I think it's really interesting to bring in these other technologies that can help us do the most with it.